Hello everyone, today I'll be presenting a simple bedside technique for post-vitrectomy rebleed. So let's get started. What is in-office FGE? Vitreous cavity rebleed is a common problem post-pars plana vitrectomy. Vitreous cavity rebleed can be managed by either a vitreous cavity lavage or an air fluid exchange. This can be performed in OPD setting via a single prick to aspirate the loose blood and replace it with air. What are the prerequisites? Completely vitrectomized eye post PVD induction and without silicone oil, preferably pseudophakic or aphakic. USG B-scan confirming the retina is attached throughout with no anterior-posterior traction and no membranes and presence of loose blood in the vitreous cavity, along with a clear cornea and a clear anterior segment media. Here is an example of a B-scan of a patient screened for this procedure demonstrating hyperreflective dot echos in the vitreous cavity. Instruments needed for this procedure will include a few sterile cotton tip buds, Castrovigio's caliper, a 0.22 microns PES syringe filter, wire speculum, a 26 gauge needle, and a 5 cc syringe. Here is a stepwise representation of how via a single prick the blood-stained fluid will be replaced with air using the aspiration injection technique. The filter is attached to the syringe and sterile air is drawn into the syringe. Then a 26 number needle is attached to the syringe. Both the periocular surface and conjunctival sac are sterilized with betadine swabs and betadine drops respectively. Topical paraffin drops are then instilled. Wire speculum is then inserted to separate the lids and the patient is made to sit. Site of insertion of the needle is marked in the inferotemporal quadrant 3.5 mm from the limbus. The air-filled syringe with 26 gauge needle is then introduced into the vitreous cavity. A small amount of air is injected and a similar volume of dispersed vitreous hemorrhage is aspirated into the syringe. This process of aspiration injection is repeated until the desired amount of air has been injected and dispersed vitreous hemorrhage aspirated. The syringe is kept with the plunger tilting downwards and the needle upwards. In this way, when the dispersed vitreous hemorrhage is drawn into the syringe, it trickles backwards towards the plunger and the same volume of air is injected back into the vitreal cavity. The tone of the eyeball is checked with a cotton-tipped bud all throughout the procedure, intermittently, to avoid severe fluctuations in IOP. Once approximately 4 ml of blood-tinged fluid is collected and an equal amount of air has been injected into the vitreal cavity, the needle is withdrawn gently with the help of a cotton bud and betadine drops are instilled. After the procedure is over, air bubbles can be visualized behind the lens. Oral analgesics and topical antibiotics are given to the patient post-procedure for a period of 1 week and the patient is asked to follow up thereafter. Here is a sample of the dispersed vitreous hemorrhage which was collected during the procedure. These are few of the before and after fundus photos of the patients who underwent this procedure. OPD FGE is a safe and effective method using a single needle aspiration injection technique to treat post-vitrectomy rebleed. It is a bedside procedure which can prevent the need for a surgical vitreous lavage and helps avoid multiple OT procedures, as these patients generally have other comorbidities, and also helps avoid additional financial burden. If patient selection is done well, it has a very low complication or failure rate. Thank you.